I want to update you on our current status. I'm sad to report an additional 13 deaths today. 12 of the people who passed away were over the age of 65, and 11 of the people who were over the age of 65 did have underlying health conditions. There was another death of a person who was younger, between the ages of 41 and 65, and this person also had underlying health conditions. This brings the total number of deaths to 78 in LA County, and our mortality rate for COVID-19 has slightly increased to 1.9%. 86% of the people positive for COVID-19 who have passed away did have underlying health conditions. For those of you who are mourning family members and friends, we're deeply sorry, and our thoughts and prayers are with you every day. Today, we're also reporting 534 new cases. That means that over the last 48 hours, we've had over 1,000 new cases here in LA County, and our total number of cases is 4,045. These cases include 139 cases reported by our partners in the city of Long Beach and 37 cases reported by the city of Pasadena, both of which have independent city health departments. We're also reporting amongst our count that 9 people are confirmed cases for people who are experiencing homelessness. 78% of all of our positive cases are occurring between people who are of the ages between 18 and 65. And this has been a pretty consistent number since the beginning. About almost 900 cases at some point of people who've been positive for COVID-19 have needed to be hospitalized, and that also slightly increasing the number now to 22% of positive cases have needed at some point during their illness a hospitalization. Currently, there are 241 people hospitalized for COVID-19, and 153 of these people are 55 and older, and 108 are older than 65 years old. 2/3 of all the people that are currently hospitalized who have a diagnosis of COVID-19 have no underlying health conditions, and they're dispersed across all age categories. So I want to be clear that while most significant death and serious illness does occur amongst people who are older and people with underlying health conditions, all people who get infected with COVID-19 at any age can have very serious illness, and that can mean that they're required to have a hospitalization. 28% of people who are hospitalized today are in the intensive care unit, and 34% of those in the intensive care unit are over the age of 65, and over 55% of folks in the intensive care unit have underlying health conditions. But I do want to note that 5 people in the ICU are under the age of 35, and a couple of the people who are young don't have any underlying health conditions. As always, you can see an updated report on the LA County cases on our website, www.publichealth.lacounty.gov. I also want to provide the update on investigations in institutional settings. Our number has jumped. We're now investigating at 54 different settings. At each one of those settings, we have at least one confirmed case of COVID-19. These institutional settings include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, jails, and prisons. The total number of confirmed cases in institutional settings has also increased to 298 people. This includes both staff and residents or guests. 175 of these confirmed cases are among residents or guests, and 114 are amongst staff. We're sad to report that 11 people who have died from COVID-19 have resided in either a skilled nursing facility or an assisted living facility. At the county jail, we currently have 7 cases. 6 of these cases are amongst staff, and 1 is amongst a person who is incarcerated. The Lancaster State Prison has 6 positive cases amongst inmates. In our shelters, there are still only 2 shelters where we have confirmed cases of people who are positive for COVID-19. That's 2 staff people and one guest at the shelter. I want to explain a little bit for a minute about what happens at the shelters when we identify a positive case. If we're able to, we quarantine at the shelter everybody who's been exposed. And sometimes at a smaller shelter, that could mean we would be quarantining the entire facility. But we also will go in with and identify who are the people most vulnerable who have had an exposure, and we move those people to an isolated site for them to serve out their quarantine. Right now, today, we just moved 22 persons experiencing homelessness who had an exposure at one of the shelters to their own individual rooms in one of our facilities that manages to offer places for people who are experiencing homelessness to either isolate or be quarantined. As of April 1st, we've tested over 23,300 people, and 13% were positive. I want to note that I think that number is slightly inflated because we still have a couple of labs that are not giving us the reports on the number of negative tests that they have processed. And again, the increase in the number of people who are positive here in LA County still directly correlates to our ability to do more testing. It also, though, unfortunately correlates to the fact that we have more people who are infected, and because we have more people who are infected, we have more people infecting other people. We've seen a lot of improvements in testing, and I want to again thank Dr. Kazan and his team, but it remains critical that we be able to prioritize testing for those most in need. And that means that we still ask that you have a lab order from a physician that in fact says it's appropriate for you, it's clinically appropriate for you to be tested. At this point, for everyone who's not experiencing any symptoms, we ask you in particular to wait about getting tested. If you have no symptoms and you test negative today, it will say nothing about your status tomorrow. Again, for people who have no symptoms at this point in time, best to let testing happen amongst those people who are in fact symptomatic. Yesterday, I discussed the fact that that both the Centers for Disease Control, the National Institutes for Health, the governor, and the mayor have all spoken about the possibility of us rethinking our advice around who should be masking and when. So I want to start by reminding all of us that there are some people who absolutely have to mask, and we all need to make sure that they have the masks that they need in order to do their jobs. And those are our frontline healthcare workers. Frontline healthcare workers need access to N95 masks. Nobody else who's not a healthcare worker needs access to an N95 mask. So as I speak about the guidance that says that it might be appropriate for you to cover your nose and mouth when you're out, I want to be crystal clear that nobody in the public should be going after getting an N95 mask. Those need to be fit tested, and we have a short supply, and we must have them for our healthcare workers so that they can be protected when they protect us when we need care, medical care. It may be appropriate if you're out and you're not able to do all the social distancing that we've asked you to do. If you're not staying 6 feet apart from people when you're, for example, at the pharmacy or at the grocery store, it is probably a good idea, given the evidence that says that you could be asymptomatic and still infectious, for you to cover your nose and mouth. But we would ask that you go online and you see how to make your own mask. They're very simple to make. There's nothing fancy about them, but that will mean that then the supply of surgical masks is available for all of the essential workers who need that to do their job, for all the sick people who need to wear one so that they don't expose anybody else to their infections, and to anybody who needs to have close contact because they're a caregiver or they live in a family where they're caring for someone who's ill. We still don't have enough surgical masks. So while the guidance is clear at this point that it's probably beneficial if you're out and about and you're going to be in contact with others as you get your essential services, that you do put a covering over your face and over your mouth and your nose. You don't really need to use up the short supply of either surgical masks or, in particular, the N95 masks. So it's really important that folks understand that while the guidance suggests that it would be beneficial to mask up when you're out and about, we're much clearer on the benefits that accrue if you do everything else we've asked you to do. Most important is social distancing. You're not going to spread germs if you're not close to people. That 6-foot barrier is essential for us to maintain, even if we're masked. I don't want people to get a sense of security. Oh, I've covered my nose and my mouth and now I can just be out and about. That is not what we're saying. You must keep that social distance. The mask will not protect you 100% from particularly from infecting others, which is really all that they are appropriate for. You need to wash your hands. Washing your hands is still the most appropriate action you can take to prevent germs from getting inside you. So wash your hands, don't touch your face unless your hands are clean. And make sure you're following all of our orders around self-isolation and self-quarantine when they're appropriate. If you're sick or if you're a close contact of a person who is sick, either with a diagnosis of COVID-19 or a possible diagnosis of COVID-19. So as we know more about COVID-19, the guidance will change. We changed it this week. It's likely that as we learn more, it will also change into the future. So I want to just make sure that we're clear about what's not changing, which is your need to stay home as much as possible. So there's been no change in that, and there's unlikely to be any change in that in the weeks to come. So please only go out to access essential services. And when you do go out, even if you have a homemade mask, we need you to practice social distancing as much as possible. We do have weeks to go, and I thank you for all you're doing to prevent becoming infected and prevent others from becoming infected. And I know it's not easy and that these circumstances are unprecedented for our entire community. But we are all in this together, so it makes sense that we work together to get through this. Please don't lose hope, and please don't stop following all of the directives that you are following right now to slow the spread of COVID-19. I thank you from the bottom of my heart for all that you're doing.